It's clearer now than ever that we're in the midst of a fifth wave.
Dr. Alex Summers says the evidence is here. The Omicron variant is circulating broadly in our community, with 228 new cases reported today, setting a new benchmark. As a result, there is now a significant backlog in contact tracing, with at least 300 people on the growing list.
Because of the large case counts, it means that the health unit will not be able to follow up as quickly with cases of COVID-19.
Up until today, the highest daily case count was 176 cases reported on April 14th at the peak of the third wave. And just 2 weeks ago, the region was reporting fewer than 40 daily cases.
Every non-essential indoor gathering that you attend increases your risk of getting COVID-19.
With the growing number of cases and testing capacity also backlogged, the MLHU has released new guidance. If you test positive, you must self-isolate immediately, along with your entire household. And if you develop respiratory symptoms, treat your illness as though it is COVID-19, even without a positive test result, and self-isolate. And reduce your indoor contact with others as much as possible. Bioethicist Maxwell Smith says further restrictions like a lockdown can buy us some extra time to curb the spread.
There are things that we could be doing a bit different, and that would be less reactive, more proactive in trying to avert these things from happening in the first place. But that requires that we all get on board to accept that, yes, even if the ICUs aren't currently overwhelmed, we're trying to prevent that from happening. So if there are steps we can take now to avert those most serious outcomes, then I think there's an ethical obligation to put them in place.
Dr. Summers says if you are out in a public space right now, it is safe to assume that at least one person in that space is transmitting COVID-19. Rita Ismail, CTV News.